Okay.
Wonderful program in a CHC like this. We'd like to thank Dr. Rati and the whole administration here to making this possible. I am representing two organizations. One is called the Association of Rural Surgeons of India and International Federation of Rural Surgeons. So what we are trying to do is train the doctors in rural and remote areas to do modern surgeries. For example, laparoscopic surgery is very relevant for rural areas because unlike the urban counterparts, they can't afford to take a lot of time off the work. They have to get back to work quickly, and their work involves a lot of physical work, and they need to have less pain and so on. So laparoscopic surgery is ideal for them. But unfortunately, it's so expensive, and also the gases that are necessary, the anesthesia which is necessary, the equipment is very expensive, so out of reach of most of the rural population. So what we have done is, we have made these surgeries possible without using gas. We have a special equipment which makes this possible. So the advantage is that we can come to even remote areas like this and do advanced laparoscopic surgeries. It is less expensive because we use spinal anesthesia and less medicines. It's easy to learn. For example, Dr. Biju, he learned this technique about 3 years ago, and now he has been able to regularly do this operation. In fact, he has done more laparoscopic cholecystectomy than I have done in the last 3 years. So it's easy to learn and do these surgeries. And he also works in a very remote hospital near Bhutan border, benefiting the Bodo tribals there. So it is one of the surgery which makes all this laparoscopic surgeries possible in rural areas. And we sincerely thank Dr. Rati and the administration for making this possible. And another thing we are doing is we also devised what we call the laptop cystoscope. The surveys show that 5% of any population, any OPD, will have urology problems. But 98% of those people with urology problem are not able to afford the urology treatment, because the cystoscope which we need for diagnosing and first line of treatment is very, very expensive. So non-urologists can't afford to invest so much money. But now we have this laptop cystoscope which connects directly to the laptop and makes this diagnosis and minor treatment possible with investment as little as 50,000 rupees. So now anybody can learn how to do urology work, and half the patient can really benefit from this. So our plan is to train doctors who are already working in rural areas with these modern techniques, so that they can do laparoscopic surgery, urology surgery and other surgeries. And the patients in these areas will benefit. It's a big advantage because people speak their own language, they don't have to spend a lot of money, they don't have to travel. So it's a big advantage if they're able to take this to rural areas and do it. And we are not only here, we are even last month we were in Malawi to train the doctors there. Next month we are going to Uganda and Kenya. So it is becoming popular all over the world, and we thank the organization here to introducing it among the tribals in Tirupura. Thank you.